Heart disease is the #1 cause of death in the United States, claiming the lives of every 1 in 4 people. Today, we're going to talk about some things to help you know what the risk factors are, numbers you need to keep track of, and steps you can take immediately to reduce your risk of heart disease. Joining us now is Dr. Pavan Kapadia, a cardiologist with Advent Health. Thanks so much for taking the time.
Thank you for having me. This is exciting.
Yeah, heart health is really important. It's still a leading killer of men and women in the United States. And today we just want to sort of set a baseline for people. Let's start out with risks. What are those risks out there that we need to know?
So there's a lot of risks out there. Your gender. Being a man, you're at a higher risk than as a woman. High blood pressure, cholesterol, diabetes, thyroid problems, family history. So if you have a family history of heart disease, that could be a risk as well.
Stress is a big thing right now. Are you seeing stress as a factor for heart health?
It is. It turns out actually stress that we always had, and we have had for many years, can build up. But then there's the added stress. The last 2 years have been stressful as well, right? COVID has added lots of stress to our lives. That certainly builds up. There's lots of lifestyle stresses, things that we don't consider as a normal, usual stress, such as work and home life. But the stresses of what we eat. Turns out actually you don't consider nutrition as a stress, but if you're not putting in the right high-octane, supreme nitro-powered fuel into your Lamborghini engine, that's the stress.
This is why I tell my son he cannot eat cheeseburgers every day for the rest of his life. He'll be in your office 100%.
That's why I tell my pregnant wife, honey, I know you love those flaming hot Cheetos right now, but they're not good for you.
Scale back.
Scale back a little bit.
9 months will be off those Cheetos in a heartbeat. We talked about some of the risk factors. So doctors are looking out for certain things, and people have probably heard the saying, know your numbers. What does that refer to? What kind of numbers?
So there's a lot of numbers that doctors look at. I think the important ones are your blood pressure, your weight, your BMI. Those things are probably the most important things, along with your diabetes numbers. Can be helpful.
Are we getting better or worse in the United States overall with that type of health?
So that's a tricky question. The last 2 years, I think the coronavirus has probably been the #1 cause of mortality for people in this country. The last 50 years beyond that, it's been cardiovascular disease. And to be honest, I think I see younger people in my office every year than I have in the past. And so I think we're probably headed towards some trouble. And I think there's a lot of great ways that we can avoid those things, and the stuff that I love talking about with my patients.
Yeah, we're due for a turnaround.
We are.
In where we're putting our emphasis on health. So what are some of the ways for people who today might be sparked to make a change? What are some of the things we can do right now?
I'm a big fan of 2 major things, and these are the things that I tell every single patient that I ever meet. Diet and nutrition, exercise and activity. Those 2 things together are more powerful than any other things I have to offer them, whether it's medicines, whether it's procedures, devices. Diet, nutrition, exercise, activity. What you put in, and what you do with it afterwards.
What is a good diet?
So
outside of the non-Cheeto, non-cheeseburger
outside of the Cheetos and
world.
cheeseburgers, I'm actually a big fan of something called the whole food plant-based diet. Basically, it's everything you think of when you think of healthy food. When we think of healthy food, most people kind of get that little cartoon bubble that says vegetables, fruits, beans, lentils, legumes, nuts, berries, whole grains, maybe some rice. But then we get that little devil that comes up on the other side and says, cheeseburgers are okay. There's some vegetables in there. But really, so what I prescribe to is something called the whole food plant-based diet. So lots of fruits and vegetables, they are good for you. Lentils, beans, they're really good for you. To some extent, I tell people to curb their food that has a face or a mother. Probably not the best for you.
Food from the earth is the way to go. Well, thank you so much. Valuable tips. And of course, anytime that you need more information, you can reach out to an Advent Health physician. We also have a website that we want to let you know about in case you want to look for more information on your own. And that is on your screen right now. For more information, go to AdventHealthCardiovascularInstitute.com. Dr. Kapadia, thank you once again. Have a lovely
Thank you for
heart month.
having me.